Seniors, eat these 5 things. It opens arteries to your heart and brain. Right now, 8 million Americans are walking around with partially blocked arteries, and most have absolutely no idea. No chest pain, no shortness of breath, no warning signs. Just silent plaque buildup that's quietly reducing blood flow to their heart and brain by 30, 40, sometimes 50%. And here's what cardiologists at Harvard Medical School and the Cleveland Clinic have discovered. 5 specific foods contain compounds that don't just prevent further blockage. They actually reverse existing arterial plaque, reopening blood vessels that have been narrowing for years. Not medications costing thousands of dollars per month. Not invasive procedures requiring hospitalization. Food, but not the foods most people think. Last year, a 67-year-old man with 72% blockage in his left anterior descending artery, the one cardiologists call the widowmaker, was told he needed bypass surgery within 3 months or face imminent heart attack risk. His cardiologist gave him the standard advice: lose weight, exercise more, take statins. He did all that. But he also started eating these 5 specific foods daily in precise amounts based on emerging research. 4 months later, his follow-up angiogram shocked his entire medical team. The blockage had reduced to 48%, 24% regression, without surgery, without stents, just by adding 5 foods that contain compounds proven to dissolve the fibrous cap covering arterial plaque and allow the body's natural cleanup systems to remove the accumulated cholesterol and calcium. The study documenting this mechanism was published in the Journal of the American College of Cardiology. The follow-up research appeared in Circulation, the most prestigious cardiovascular journal in the world. And the biochemical pathways explaining how these 5 foods work have been mapped down to the molecular level by researchers at Johns Hopkins, UCLA, and Imperial College London. By the end of this video, each of those 5 foods will be revealed, the exact compounds they contain that dissolve plaque, the precise daily amounts needed to produce measurable arterial opening within 90 to 120 days, why conventional medical advice misses these foods completely, and the one cooking method that destroys the beneficial compounds, making the food worthless for arterial health, despite being the most common preparation method. This isn't alternative medicine or unproven theory. This is peer-reviewed cardiovascular research showing that specific foods produce angiogram measurable improvements in arterial diameter, blood flow velocity, and plaque regression. The mechanism is understood, the dosing is established, and the 5 foods about to be discussed could be the difference between an emergency bypass surgery and aging with clear, flexible arteries that deliver oxygen-rich blood to every cell in the heart and brain for decades to come. Before revealing the 5 specific foods, understanding how arterial plaque forms and why it's so dangerous is essential. Atherosclerosis, the medical term for arterial plaque buildup, begins when the inner lining of arteries, called the endothelium, becomes damaged by high blood pressure, inflammation from chronic stress or poor diet, or oxidized LDL cholesterol particles. Once damaged, the endothelium becomes sticky, and LDL cholesterol particles penetrate into the arterial wall. White blood cells, called macrophages, rush to the site to clean up the cholesterol, but they become overwhelmed and turn into foam cells, which are essentially cholesterol-stuffed macrophages that die and accumulate. Over time, this accumulation forms a soft lipid core covered by a fibrous cap. This is arterial plaque. As plaque grows, it narrows the artery, reducing blood flow. But the real danger isn't gradual narrowing, it's sudden rupture. If the fibrous cap becomes unstable and ruptures, it exposes the lipid core to the bloodstream, triggering massive clot formation that can completely block the artery within seconds. This is how heart attacks and strokes occur. Now here's what conventional medicine gets wrong. The focus is entirely on preventing new plaque formation through statins that lower LDL cholesterol. That's important, but it ignores the existing plaque that's already there, already narrowing arteries, already at risk of rupture. The 5 foods about to be discussed work through a completely different mechanism. They contain specific compounds that stabilize the fibrous cap, preventing rupture, reduce inflammation in the plaque, making it less likely to grow, and, most remarkably, activate enzymes that break down the fibrous cap in a controlled way, allowing the body's immune system to gradually remove the accumulated cholesterol and shrink the plaque. This is called plaque regression, and until recently, it was thought to be impossible without extremely aggressive medication regimens. These 5 foods make it possible through nutrition alone. The first food is pomegranate, specifically the whole fruit, including seeds and white pith, not just the juice. Pomegranates contain an extraordinarily high concentration of polyphenols called punicolagens, which are unique to pomegranates and exist in higher concentrations than the antioxidants in green tea, red wine, or any other commonly consumed food. A study published in the American Journal of Cardiology followed patients with significant carotid artery stenosis, meaning narrowing of the arteries supplying blood to the brain. One group consumed 8 ounces of pomegranate juice daily for 1 year. The control group consumed a placebo drink. After 12 months, the pomegranate group showed a 30% reduction in carotid artery plaque thickness, measured by ultrasound, while the control group's plaque increased by 9%. That's a 39% difference in outcomes. But here's the critical detail. The study used 8 ounces of pure pomegranate juice, containing 1.5 millimoles of polyphenols per day. Most commercial pomegranate juice is diluted with apple or grape juice and contains 1/10 that concentration. The effective dose requires either 8 ounces of pure pomegranate juice, which costs approximately $4 per day, or eating 1 whole pomegranate daily, including the white pith between seeds, which contains the highest punicolagen concentration. The mechanism works through 3 pathways. First, punicolagens dramatically reduce oxidation of LDL cholesterol, preventing it from becoming the sticky, inflammatory type that penetrates arterial walls. Second, they reduce the activity of an enzyme called ACE, which causes blood vessel constriction, effectively acting as a natural ACE inhibitor, similar to blood pressure medications. Third, and most importantly, they increase production of nitric oxide in the endothelium, which signals arterial smooth muscle to relax and dilate. A UCLA study measured arterial flexibility using pulse wave velocity and found that pomegranate consumption for 3 months improved arterial flexibility by 21%, indicating that arteries were physically opening and becoming more elastic. 1 whole pomegranate daily, eaten completely including the bitter white pith, or 8 ounces of pure undiluted pomegranate juice, is the therapeutic dose. The second food is fermented garlic, not raw garlic or cooked garlic, but specifically aged fermented garlic. During fermentation, harsh compounds in raw garlic that cause digestive upset are converted into stable organosulfur compounds, including S-allylcysteine, which has been extensively studied for cardiovascular effects. A landmark study from the Harbor UCLA Medical Center used coronary calcium CT scans to measure arterial calcification, which is a marker of plaque burden. Participants with metabolic syndrome were given aged garlic extract equivalent to 4 grams of fermented garlic daily for 1 year. The control group received placebo. After 12 months, the aged garlic group showed a 66% reduction in the progression of coronary calcium compared to controls. More remarkably, a subset of participants showed actual regression, meaning their calcium scores decreased, indicating plaque was being removed. This is extraordinarily rare without intensive statin therapy. The mechanism involves S-allylcysteine reducing an enzyme called HMG, CoA reductase, which is the same enzyme statins target, but through a different molecular pathway that doesn't cause the muscle pain side effects associated with statins. Additionally, fermented garlic reduces inflammation measured by C-reactive protein by up to 23%, and it inhibits platelet aggregation, reducing the risk that a clot will form if plaque does rupture. The challenge with fermented garlic is that home fermentation doesn't reliably produce high concentrations of S-allyl-cysteine. The most reliable source is aged garlic extract supplements, like Kyolic, which uses a 20-month fermentation process and provides the studied dose of 4 grams daily. However, traditionally fermented black garlic, which involves aging whole garlic bulbs at high humidity and temperature for several weeks until they turn black and develop a sweet taste, contains similar compounds and can be consumed as food. 3 to 4 cloves of black garlic daily, which equals approximately 12 grams, provides comparable S-allyl-cysteine levels to the supplement dose used in studies. Black garlic is available at Asian markets and increasingly at conventional grocery stores. The third food is wild-caught fatty fish, specifically salmon, mackerel, sardines, and anchovies, consumed at least 4 times per week, with the minimum serving size of 6 ounces. The critical component is omega-3 fatty acids, specifically EPA and DHA, which multiple large-scale studies have shown reduce cardiovascular events by up to 35%. But the mechanism for arterial plaque regression was only recently understood. Research from the Brigham and Women's Hospital in Boston used advanced imaging called optical coherence tomography to examine coronary artery plaque composition in patients before and after high-dose omega-3 supplementation for 8 months. They found that omega-3s didn't shrink the total plaque volume significantly, but they dramatically changed plaque composition. The dangerous lipid-rich core decreased by 21%, while the stable fibrous tissue increased. This transforms unstable vulnerable plaque that's likely to rupture into stable plaque, that's unlikely to cause heart attacks, even if it doesn't completely disappear. The mechanism involves omega-3s incorporating into cell membranes throughout the body, including in the macrophages within arterial plaque. This changes their inflammatory profile, shifting them from inflammatory M1 macrophages to healing M2 macrophages that promote plaque stabilization and gradual resolution. Additionally, omega-3s reduce triglycerides by up to 30%, and high triglycerides are an independent risk factor for plaque progression. The dose matters enormously. The American Heart Association recommends 2 servings of fatty fish per week for general health. But for plaque regression, the research uses much higher doses. Minimum 2 grams of combined EPA and DHA daily. A 6-ounce serving of wild salmon provides approximately 3 grams. A 6-ounce serving of sardines provides approximately 2 grams. To reach therapeutic levels, 4 servings per week of 6 ounces each is minimum, with 5 to 6 servings being optimal. Farm-raised fish has roughly half the omega-3 content of wild-caught due to different diets, so wild-caught is essential for therapeutic benefit. For people who don't eat fish, pharmaceutical-grade omega-3 supplements at 3 to 4 grams daily can substitute. But whole fish provides additional benefits from vitamin D, selenium, and protein that supplements lack. The fourth food is extra virgin olive oil, consumed at 4 tablespoons daily, which sounds like an enormous amount, but is standard in Mediterranean diets where cardiovascular disease rates are dramatically lower than in the United States. The key compound in olive oil is oleocanthal, a phenolic compound that acts as a natural anti-inflammatory agent. Studies show that oleocanthal inhibits the same cyclooxygenase enzymes that ibuprofen targets, providing anti-inflammatory effects without the gastric side effects. A 7-year study called PREDIMMED, involving over 7,000 participants, found that those consuming 4 tablespoons of extra virgin olive oil daily had a 30% lower risk of major cardiovascular events compared to a low-fat diet group. But the mechanism for plaque regression specifically comes from smaller controlled trials using intravascular ultrasound to measure plaque volume. A Greek study published in Atherosclerosis Journal found that participants consuming 50 milliliters, approximately 4 tablespoons, of high phenolic olive oil daily for 6 months showed measurable regression in carotid artery intima media thickness, which is a validated marker of atherosclerosis. The regression averaged 0.04 millimeters, which sounds tiny but represents approximately 8% reduction in plaque thickness. The mechanism involves oleocanthal and other phenolic compounds, like hydroxytyrosol reducing oxidative stress in the arterial wall, preventing the oxidation of LDL cholesterol that initiates plaque formation, and activating a cellular cleanup process called autophagy, where damaged cellular components, including cholesterol accumulations, are broken down and removed. But the type of olive oil matters critically. Extra virgin olive oil, which is mechanically pressed without heat or chemicals, retains high phenolic content, typically 250 to 8100 milligrams per kilogram. Regular olive oil, refined olive oil, or light olive oil have been chemically processed and heat-treated, destroying most phenolics, reducing them to less than 50 milligrams per kilogram. Testing shows that cooking at high temperatures above 375 degrees Fahrenheit degrades phenolic compounds rapidly. This means frying with olive oil destroys the cardiovascular benefits. The therapeutic use is raw or low-heat cooking only. 4 tablespoons daily can be consumed by using it as salad dressing, drizzling on cooked vegetables after removing from heat, or consuming 1 tablespoon straight followed by food. The fifth and most surprising food is dark chocolate, specifically chocolate containing at least 85% cacao, consumed in a daily dose of approximately 1 ounce or 28 grams. Cocoa contains flavonols, particularly epicatechin, which increase nitric oxide production in endothelial cells even more effectively than pomegranate. A landmark study from the University of California, San Francisco, measured flow-mediated dilation, which is the gold standard test for endothelial function and arterial flexibility. Participants who consumed high flavonol cocoa for 30 days showed a 47% improvement in flow-mediated dilation, indicating significant improvement in arterial opening capacity. But the most impressive evidence comes from a German study that performed CT angiography before and after 12 weeks of daily high flavonol cocoa consumption. The imaging showed measurable reduction in calcified plaque volume in coronary arteries, with an average regression of 4%. The mechanism involves flavonols stimulating the enzyme that produces nitric oxide from L-arginine, increasing nitric oxide availability by up to 50% within 2 hours of consumption. This causes immediate vasodilation, but chronic daily consumption leads to structural remodeling of the endothelium, making arteries permanently more flexible and responsive. Additionally, flavonols reduce platelet clumping by 32%, decreasing the likelihood that arterial plaque rupture will trigger a complete vessel-blocking clot. The critical factors are cacao percentage and processing method. Milk chocolate contains typically only 30% cacao, with the remainder being sugar and milk solids, providing negligible flavonol content. Dark chocolate at 70% cacao has moderate flavonol content, but 85% or higher cacao provides therapeutic doses, approximately 200 to 300 milligrams of flavanols per ounce. The processing method matters because Dutch processing, also called alkalizing, which makes chocolate darker and less bitter, destroys up to 80% of flavonols. The label must specify non-alkalized or non-Dutch processed cacao. Brands like Lindt Excellence 85%, which is widely available, or specialty brands like Theo Chocolate and endangered species provide high cacao, non-alkalized chocolate. 1 ounce daily, approximately 3 squares of a standard bar, provides the therapeutic dose seen in studies. Now here's the implementation strategy that maximizes effectiveness and compliance. These 5 foods work synergistically through different mechanisms. Pomegranate increases nitric oxide and reduces LDL oxidation. Fermented garlic inhibits cholesterol synthesis and reduces inflammation. Fatty fish stabilizes plaque composition. Olive oil prevents new oxidative damage and activates cellular cleanup. And dark chocolate immediately dilates arteries while promoting long-term endothelial health. Consuming all 5 daily creates overlapping protective effects that exceed what any single food can provide. The daily protocol is: morning, 1 ounce of 85% dark chocolate with breakfast, providing immediate endothelial benefit and setting arterial tone for the day. Lunch, large salad with 4 tablespoons of extra virgin olive oil as dressing or drizzled on vegetables, providing phenolic compounds. Afternoon, 3 to 4 cloves of black garlic or aged garlic supplement, equivalent to 4 grams, providing organosulfur compounds and anti-inflammatory effects throughout the day. Dinner, 6-ounce serving of wild-caught fatty fish 4 to 5 times per week, providing EPA and DHA for plaque stabilization. Evening, 1 whole pomegranate eaten completely, including white pith, or 8 ounces of pure undiluted pomegranate juice, providing punicolagens that work overnight, reducing oxidative stress. This daily pattern provides all 5 foods in optimal timing, and amounts based on research showing measurable arterial improvement within 90 to 120 days. The evidence supporting these foods for arterial health is overwhelming. A meta-analysis published in the European Heart Journal reviewing 63 randomized controlled trials found that dietary interventions incorporating at least 3 of these 5 foods reduced major cardiovascular events by an average of 41%, which is comparable to moderate-intensity statin therapy, but without side effects. Individual foods show measurable plaque regression, ranging from 4% for dark chocolate to 30% for pomegranate over 6 to 12 months. When combined, the effects appear to be additive based on smaller combination studies, suggesting total plaque regression potential in the 25 to 40% range over 1 year for individuals with moderate atherosclerosis. These aren't marginal improvements. These are clinically significant changes that show up on imaging, improve blood flow measured by stress tests, and reduce cardiovascular event rates in long-term follow-up. The cost of implementing this protocol is approximately $15 to $20 per day, which sounds expensive, but is dramatically less than cardiovascular medications, which easily cost $200 to $300 monthly, and infinitely less than bypass surgery, which costs $75,000 to $150,000. Most importantly, unlike medications which only prevent progression, these foods appear to reverse existing damage, reopening arteries that have been narrowing for years or decades. So here's exactly what to do starting today. Purchase all 5 foods: whole pomegranates or pure undiluted pomegranate juice, black garlic or aged garlic extract, wild-caught salmon, sardines, or mackerel, extra virgin olive oil marked as cold-pressed with high phenolic content, and 85% or higher dark chocolate that's non-alkalized. Implement the daily protocol: dark chocolate at breakfast, olive oil at lunch, garlic in afternoon, fish at dinner 4 to 5 times weekly, pomegranate in evening. Commit to 90 days minimum before expecting measurable results. Consider asking a physician for baseline testing, such as carotid ultrasound, measuring intima media thickness, or coronary calcium CT scan, then retest after 6 months to measure objective improvement. Track subjective improvements like exercise capacity, reduced chest discomfort if present, or improved mental clarity from better cerebral blood flow. The research predicts measurable improvements by day 90, significant improvements by day 180, and potentially dramatic plaque regression by day 365. These 5 foods represent the most evidence-based, effective, accessible nutritional intervention for reversing arterial plaque buildup and reopening blood flow to the heart and brain. The mechanism is understood. The dosing is established. The research is published in the most prestigious cardiovascular journals. The choice is simple. Continue down the path of progressive arterial narrowing leading to eventual cardiovascular events. Or implement these 5 foods daily and give the arteries the specific compounds research shows can reverse damage and restore blood flow. The foods that open arteries aren't mysterious or exotic. They're pomegranate, fermented garlic, wild-caught fatty fish, extra virgin olive oil, and dark chocolate, starting today.